So we'll refer to it as the 2020-2021 budget. It comes within the COVID times. You know, some time ago, Mr. Speaker, we used to refer to things as pre-Maria and after Maria. Now we're going to refer to things almost as pre-COVID, during COVID, and hopefully after COVID. But it's really a pleasure to be here to express my full support to this budget of 2020-2021. I always knew I was a blessed person, but when I heard the delivery of the Prime Minister, I thought I was more blessed because I didn't have to go against that budget. I thought I was just so lucky to be on the side of the budget, so that was good news for me. Anyway, coming to think of it, Mr. Speaker, every sector has been handled in this budget, every single sector. And considering the constraints and the financial difficulties the world is faced with, I don't think any better budget could have been presented, but this budget that the Prime Minister presented. That's the best possible in these possible times. So, and then when we look at all the different areas that have been touched, whether it's education, whether it's regards the tax amnesty, whether it's regard first-time home owners, when you talk about small business, tourism, agriculture, every single aspect has been dealt with in this budget. As for health, the government had to cut back on expenditure and limit wastage. So they had to cut back on utilities and rents and transfers and non-discretionary essential expenses. And there was one ministry that the goods and services wasn't cut back on. That was the Ministry of Health. What it tells you, Mr. Speaker, is the emphasis that this government places on health of the people. There was absolutely no compromise as regards to the health of the people. So all of the ministries, we had to cut back on different areas, but not health. So that shows you the importance. And not only that, health has the third largest percentage in this budget. After the Ministry of Finance, after education, and health has the third largest proportion of this budget. So it also tells you the emphasis that is being placed on health by this government. Now, this new health system that we're putting forward for the people of Dominica, we had to go back to the drawing board and we had to do some research. And we decided, let us do it with some knowledge from PAHO and WHO. And then we decided together with PAHO what we're going to do. And this is the journey that we're going to take through. That is the transformation and strengthening of the Dominica health system. It would be effected through a reorientation of the model of care that is currently biomedical and disease-based. We're shifting away from this. What we're coming to is a people and a community-based health system. And how are we going to do this? Through the services that are promotive, that are preventive, curative, rehabilitative, and palliative, and in an integrated manner, whilst ensuring efficiency, accountability, affordability, and effectiveness of the health services delivery through an enhanced management and governance framework. Now, to get to this stage, what we're going to do is a system that is affordable. It is an ongoing improvement and a strengthening system. It is resilient and is also sustainable as well. So it's not a Vice situation where we just do things like that. Everything is a plan. It's not just doing things in an ad hoc manner. Everything has to be done in a plan, and we have a strategy for that, Mr. Speaker. Let me just check what time I started, 22. Okay. So, the Pan American Health Organization helped us, and we have 6 pillars on which we're going to build this new health system that we're talking about. The first one is expanding the capacity at the primary healthcare level. That is where we're turning our type 3 health centers into polyclinics. And then we're turning our type 1 into community health and wellness centers. Now that is important because that's at the primary health level. That's at the base of it. That's where we get in contact with all the initial stage of promoting health. After this, we have the second level, that is improving the management of our hospitals. So we have the primary health care, that's one pillar. We have the management of our hospital, that's the second pillar. There we're going to have different boards and a CEO that we can manage this health system properly. Thirdly, we have integrating the levels of care. That is a better information system, the ICT, and integrating the health teams. Fourthly, we have the development of a Dominica Health Service Authority that's going to manage the entire health system. And fifthly, we have the strengthening the Ministry of Health, Wellness and New Health Investments by the new entities. That is to improve governance, stewardship, and public health. The sixth pillar, Mr. Speaker, is enhanced financing arrangements. When we talk about this, we talk about increased diversity source of public funding, national health insurance option. We also talk about the strategic allocation of finance to primary care, and we have the policies for private practice in the public hospitals. So the National Health Commission is the commission that's going to help us to transition from this old system into the new system, which is what I'm talking about, which is based on the 6 pillars that I mentioned. Now, having said this, we're going to come to the first pillar, that is the primary health care. And that is the first level of health where the health personnel, the health providers get in contact with the people at the homes. These are the foot soldiers. And we've trained 27 last year of these community health aides. And this year, we're discussing, actually I had a discussion with PAHO, and we're going to train another set of community health aides. And PAHO is very willing, they're enthusiastic, and that will be starting very soon. So we'll be having more community health aides at, these are our foot soldiers, and they will be handling that aspect of primary health care. Now, this is very important, because what this does is we put in a health system that is, as I say, is sustainable. This is where we have the interventions. This is where we have the preventive measures. We talk about lifestyle adjustments. We talk about diet. We talk about exercise. These are the things that we can put in place to prevent the complications and the tertiary aspects of health. So this is where if we have a strong primary healthcare system, we can limit all these different complications, and it's more cost effective because we wouldn't have to get to that stage. So that is the importance of the primary healthcare system, and that's where health promotion comes into place. As a matter of fact, just this week, on Tuesday, we graduated 25 nursing assistants. That is the licensed practical nurses. And we must congratulate these 24 that just graduated. These are nursing assistants. These are the licensed practical nurses. They did very well, and these are going to join the healthcare system. So this is just not alone the community health aides, but even nursing assistants. We're training more and more and more because we know we have to put these people out there to do the job for us. Now, let alone, that's just in terms of the staffing. We have to recognize that we have 12 polyclinics being built. So far, we have completed Bellevue, Chopin, Georgetown, Marigot, and Vickers. And Wesley and Maho will come in August 14th. We should be done of this year. The other two, which is Penville and Bagatelle, will be complete in October 28th. Mr. Speaker, our polyclinic in Penville also has a dental center. You don't hear about those things in developing countries, sister. We have a dental center in a polyclinic here. Then the other 4, that is the Newton, Soufriere, Colio, and Ansdime. These will be done. We are acquiring the land, and this will start this year. All this going on in this financial year. Now, Mr. Speaker, these health centers, they have the doctors section, the nurses section, pharmacy, washrooms, waiting areas, and we actually have 2 extra rooms we can use for maternity as well. Let alone that, upstairs of these health centers, where we have accommodation for nurses. What that means, Mr. Speaker? It means, one, the time you get to the health center and for the nurse to see you, it's just a matter of coming downstairs, Mr. Speaker. We don't have to wait for the nurse to come from her home. Secondly, if we have the quarters there for the staff of the health center, what it means also, the government is going to cut down on the accommodation costs we have to pay for nurses. And that is significant, Mr. Speaker. Then if we go further in terms of all these different health centers that we're talking about, what are the services that they offer at those different health centers? We have the maternal and child health clinics. We have the general morbidity clinics of the non-communicable disease, that is high blood pressure and diabetes and so forth. We have cancer screening going on. We have our immunization program going on. We have our food handlers, pharmacy, home visits. These have been going on, and this will continue because finance has been provided for these ones in this new financial year. The dental care, the home visits, the school promotion, the eye promotion, and the hearing promotion, which I'll mention later in some of the services that I'm going to mention again. And environmental health and health promotion, and all these are going on. As a matter of fact, Mr. Speaker, our immunization program through our healthcare system, we had 95% over the past 10 years of immunization. And the good news is that, can you imagine, we also getting the HPV vaccine to all our 11 and 12-year-olds and our grade 5, such that PAHO, not OECS or CARICOM, PAHO has selected Dominica for the immunization week of the Americas. And we're supposed to have a function here. That was supposed to have been here in May. And at that immunization week of the Americas, where all the countries under the Pan-American Health Coordination will be here, and the District of La Plaine was supposed to have been singled out for an award and a trophy for achieving 100% HPV vaccination in the La Plaine Health District. Mr. Speaker, PAHO is the one that selected the La Plaine Health District for this award. This means a lot. This is a very expensive vaccine, and the government of Dominica is giving this vaccine to all grade 5 and 11 and 12-year-olds free of charge. Now, in terms, and let alone the health centers, in terms of the time factor to see the patient, in terms of cutting down the cost of accommodation, but it's the comfort for our nurses, Mr. Speaker. This is what is significant. We provide some lovely apartments upstairs for the comfort of our nurses so that they can provide the care that the country wants, that the people want of this country. And, Mr. Speaker, with 12 polyclinics in this little island, can you imagine? We have more polyclinics than Barbados. With the healthcare system that Barbados has, we actually have more and maybe the most polyclinic per capita in the entire Caribbean. We have more than Barbados. So when we look at this primary healthcare system, Mr. Speaker, so first and foremost, we have to know that all the services there are free of charge. Secondly, we have 24-hour service at these 7 days a week at all these primary health cares, all these polyclinics that are going to be built. At these health centers, we have HIV rapid testing. Where do you hear that in the world, in all rural areas, we have rapid HIV testing at our 7 health districts, Mr. Speaker. That is serious business. That is what this healthcare system is all about. And then, Mr. Speaker, at these health centers, we have the ASSIST program. These are programs geared at capturing and monitoring babies and infants who may have been exposed to the Zika virus. At these health centers and these health districts, we have this Taki Hearing program, a foundation making hearing healthcare services more accessible in over 100 countries all over the world, including Dominica, Mr. Speaker. We have the Diabetic Retinopathy Screening and Treatment program, with the support of the London School of Hygiene and the Queen Elizabeth Diamond Jubilee Trust. We have the home visit programs, and I mentioned the immunization program, 95% over the past 10 years, and protecting our children. We have the breastfeeding initiative, and PMH remains a baby-friendly hospital. All this going on at our health districts. That is primary health care in Dominica, Mr. Speaker. Let alone this, our non-communicable disease policy, where we focus on childhood obesity. All these are preventive measures, so we do not have to get to the stage of all these communicable diseases. And our tobacco control, 75%, that is maybe one of the highest in anywhere in the CARICOM, because that is how we think ahead. These are the risk factors for the communicable diseases. So if we can handle tobacco, we can handle obesity, we're thinking of the future. That's a proactive approach we have to help, Mr. Speaker, where we go in the preventive way. We also utilize our Cuban doctors in our healthcare system. And because of all of this, this is why we've been having such achievements in our healthcare system. This is why Dominica is well on its way to be certified as a nation free of mother-to-child transmission of syphilis and HIV. Not many countries have achieved that, Mr. Speaker. And PAHO was just here a few months ago going through the assessment. Very soon we'll be certified as a nation free of mother-to-child transmission of syphilis and HIV. These are great achievements, Mr. Speaker. Not many islands can boast of that in the OECS or the Caribbean, but Dominica can boast of those things, Mr. Speaker. The number of new cases and prevalence of HIV in Dominica is among the lowest in the OECS as well. And these are statistics from WHO. So you can research those statistics, anybody want to debate those statistics. And the government absorbs the entire cost of HIV treatment. Every single cent, the government pays for that. And this is all part, that is how we reap in those benefits. In terms of services, the number of doctors and nurses per population per 10,000, Dominica's maybe the highest in the OECS. As a matter of fact, I think we have the highest in the OECS. And it is high in comparison to almost quite a few other countries in the CARICOM as well. And we are well on the way in achieving the WHO #1 goal, that is universal health coverage. That is the #1 goal of the WHO, and we're well on the way in achieving that goal. Now, Mr. Speaker, and I said earlier, 95% of immunization over the past 10 years. And as I mentioned earlier also, the HPV vaccine, which PAHO was giving us the award for, and what we did, it was done in other Caribbean islands, but they handled this HPV vaccine from a sexually transmitted point of view. We were sharper than this. We researched it. We decided let's handle it from a cervical cancer point of view. And that is how we achieved it, Mr. Speaker. The proactive thinking. You don't go out there and tell a child you're going to give a vaccine because about sexually transmitted infection. We decided let's talk to the parents, let's talk to the children, let's get it from a prevention of cervical cancer. And that is why we were successful. PAHO was stunned that initiative approach of ours. Now, Mr. Speaker, that's primary health care. That was the first pillar. I'm watching the time, don't worry. A gift for the People's Republic of China, our hospital, our Dominica China Friendship Hospital, a $50 million gift from the People's Republic of China. Hunan Construction Engineering Group is the one putting this together. Obviously, phase 1 is over. That is our accident and emergency department, and then we have our medical technology building #1. This house is, well, we have the accident emergency, and we have our lab. Now, Mr. Speaker, when we talk about lab, it really means a lot to us. Our lab, can you imagine recently what we did, and I must thank the Minister for National Security, that we could get a biotechnical engineer to come and install a biosafety cabinet at our lab. Now, with this biosafety cabinet, we have an entire cabinet meant for COVID. So initially we had a biosafety cabinet. It was being shared by the different departments. We've gotten one specifically for COVID. So now, Mr. Speaker, let alone the fact that we have PCR capacity, which other OECS islands might not have, I know some of them don't have. And we have capacity. So now, we don't only do 25 PCR tests in a day, we've brought it up to 100 PCR tests in a day. Mr. Speaker, we can do 100 PCR tests in a day. Let alone this, we're going to get an automated extractor. With the automated extractor, we're going up to hundreds in a day. That is where we're looking ahead. So when we get this automated extractor, that is when we can be going to hundreds a day. That is how we're looking ahead. Not because we're COVID-free that we're sitting down and sleeping on us. No, we're thinking ahead. The more we can have, the better we can have. That's the better prepared we can be. Let alone this, Mr. Speaker, we're getting another PCR machine next month. It's coming from Germany through the International Atomic Agency. And this one, the Minister of Trade is pleased because this will be placed at the Center of Excellence in Stockholm. And there we have more PCR capacity. So can you imagine we having a lab at our hospital that does PCR, etc., and we'll be having the public lab at the stock farm at the Center of Excellence where we can do PCR, even more PCR again, Mr. Speaker. We have chemistry machine at our lab at the hospital, state of the art. And this can also do the serological testing for COVID. As a matter of fact, it's being validated now. So we can do even more than 100 serological COVID tests, that's the blood test for the antibody, at our lab at the PMH. This is because of our new chemistry machine, which can also do the other things such as troponin for heart attacks and all our hormonal tests, and can do A1C. We already do A1C, but with that machine, we can actually do more. So this is the sort of equipment. No longer you haven't heard chemistry machine breakdown at PMH. Those days are gone, Mr. Speaker. We have extra machines. So those days of this breakdown there at the lab, out of the question, Mr. Speaker. And let alone this, Mr. Speaker, you have to see our lab. We are now in the Caribbean Meds Lab Foundation was here. I saw them actually in January, and we're here to discuss the accreditation of our lab, which is actually the final thing that we're going to. And we're going to revisit this, because accreditation of our lab is all part of accreditation of our hospital. That is the bigger picture. That's what we're looking for in the future. So when you talk about this and our staff at the lab, I mean, our staff is the envy of other OECS countries. They ask us to train their people. That's the sort of staff we have at our lab. Authorities in molecular testing, these are the staff, Mrs. Jemot, Mr. Jones, Mr. Carbon, and Sem. These are the people we have at our lab, the envy of other OECD countries. Other countries, they don't have people trained in molecular technology. We have more than one and more than two and three going. That is the level we are at our lab at the Dominica China Friendship Hospital. And recently, Mr. Speaker, can you imagine, Dominica participated in a WHO, that is the International Quality Assessment. It's an international thing and quality assessment for COVID-19 PCR. We passed in flying colors. We'll be getting the certificate very soon. We just haven't got the paper yet, we're going to get it. But the word is that we passed with exceptional flying colors, Mr. Speaker. And that is international done, and that is with WHO, and that is international quality assessment for our lab. But that's just one part of our lab in the phase 1. And then we have our dialysis unit, we have our radiology unit. We got the couch for our CT scan. We tried our very best to get the technicians from Puerto Rico to have it mounted. The COVID has put us back on that. As soon as they can come, yes, it's going to be mounted. And our MRI and our HIFU has been commissioned, and training, we're going to get training for them. We've sourced the area where to get the training and where we get it from. As soon as all of these COVID things settle down in terms of the borders and transportation, that will be done as well. So that's for imaging. Our dialysis unit is there, ambulatory care is there, and the endoscopy, fluoroscopy, echo, mammogram, all of this is there as well. Phase 2, which is our expedometry and ophthalmology department. Our ophthalmology department is going to be another center of excellence. Gone are the days when Dominica had one ophthalmologist. We actually have 3 ophthalmologists on island, in this little island. 3 ophthalmologists, and we have this brand new part where we have an eye theater specifically for eye. This is the center of excellence in terms of ophthalmology that will be right up there at our Dominica China Friendship Hospital, Mr. Speaker. Let alone, then we come to phase 3, where we have our medical technical building, we have the operating theaters, intensive care, the blood donors, etc. And in phase 4, administrative and teaching building. That is an important part, the administrative and teaching building of that hospital, because this is where we're going to continue the education and the learning process. In medicine is a field, you don't just graduate and that's the end of it. You have to continue the professional training. And that is exactly why we have this amphitheater, this lecture hall, and the teaching building at our Dominica China Friendship Hospital as well. The next stage, which will be the phase 5, that starts in October 2020, and phase 6, where the roads and the lighting and all of this will take place. So at the end of this, by December 2021, we should have our complete state-of-the-art Dominica China Friendship Hospital. And as for staffing of this, yes, we've been training our specialists. As a matter of fact, 17 of them, some have come back already, and some are due to come back this year as well, in all the different departments. Mr. Speaker, some time back, no one knew about cardiology department, urology department, oncology department, and ICU and those things. Under this Labour Party government, these are all the different departments have been added to our hospital. These were not there before. Cardiology, urology, oncology, ICU, and we're going to continue adding more departments to the Dominica China Friendship Hospital. Mr. Speaker, on hospitals, we cannot just stop the Dominica China Friendship Hospital. We have to mention the Northeastern Hospital, which is being built in Marigot. We have to mention it. And the Marigot Health District extends from Calibishi all the way to Crayfish River. And that's the Northeastern region. And that will serve that entire region. And it started just in January this year, Mr. Speaker, and it's going to be completed in April of next year, 2021, funded by CBI funds. But it is significant to know that what this does is we decentralize in healthcare. People cannot be coming to Roseau for everything. So we decentralize healthcare. So that is why we're building this state-of-the-art hospital in Marigot. So now, not only that, you have to consider the fact that the international airport is going to be built. So we need a hospital close to the national airport. God forbid anything happens, but this is the planning. This is what's happening. And not only that, we have to consider the tourism boost that is going to take place in the north with the hotels. So we need to have that hospital there as well. So many different reasons why the hospital is significantly built in Marigot, for Marigot people and for the rest of Dominica as well. But this hospital takes it to a next level. Can you imagine the basement of this hospital, Mr. Speaker? We have things like a chapel. We have things like a health education center. We have underground water storage. So everything is being taken into consideration. This is building resilience. This is building sustainability. This is the future of health in Dominica, Mr. Speaker. And then the services, obviously, accident and emergency will be there, pharmacy, lab will be there. And then also we have the mental health part of it, maternity, dialysis. So can you imagine a hospital that's not in the capital having dialysis, X-ray, operating theaters, things unheard of, but is going to happen in this beautiful nature isle of ours. And then we have also the intensive care unit at this hospital. It's a 40-bed hospital, 15 male, 15 female, and 10 children that wards, with private rooms as well. So besides ICU and all of these things, we have all these other amenities at this hospital. Now, with these hospitals, which was the second pillar, with these hospitals, what we have is a new data center. The new data center, because you've heard a lot about the digitalizing of Dominica. So we have a new data center where the APU was at the hospital, downstairs the APU. And that, we have all the servers there. We have completed the setup, and all we're waiting for is for the Dominica Channel Friendship Hospital to finish, for the Marigot Hospital to finish, then we can connect them. All the fibers are going to be set up. So this is help. This is the sort of planning that's going on. So while we're just waiting for the hospital to be completed, and then we're going to hook them up with our new data center. Now, Mr. Speaker, apart from all of these, we have PAO that's helping us with our smart facility initiatives. And this initiative, what it does is to have a safe and green sort of for our new health centers. We're smarting them up. They're going to be resilient. We've installing the new structural elements so that we can be climate resilient, the energy saving units, both the electricals as well, and all our faucets and our toilets. We have them, the sensor ones, such that we'll be using 30% less compared to our previous level. This is how we put in health together with resilience and sustainability and the eco aspect of it. We also have diesel standby generators in the case that there is maybe some disaster, that we can function even after disaster. So all of these are the smarting facilities. Lapland was the first one done in 2018. Portsmouth is almost complete, and then Grand Bay we're also getting done, which is 46% complete and should be over in November of 2020. The Roseau Health Center, which was supposed to be part of the smarting program, but wisely enough, the Prime Minister thought if you're going to have such the Roseau Enhancement Program, and this is our capital, we're going to build a new health center in the capital, Roseau. Regarding our other health centers, St. Joseph, Cassibruce, Salibia, Foncollet, Wesley, we had the solar system installation. That's all part of our resilience and our sustainability as regards to health. And in terms, well, that brings us to the next section, Mr. Speaker, when we talk about the OECS projects that we have, the OECS Regional Health Project. The fourth component of this one, which is the contingency emergency resource component. This is where this helped us with our COVID-19. And having said this, let me just tell you that internationally the cases are 17,327,852. The amount of deaths is 672,855, and the amounts recovered is 10,823,541. Now, this is because the emergence of this novel coronavirus, that was in December of 2019, and it became a public health emergency of international concern in January 30th, 2020. And the pandemic status was in March 11, 2020. But Mr. Speaker, since in early February, we were already planning and deciding. We had press briefings, we had press conferences, that's in February, even before it became a pandemic. What this tells you is that we didn't panic, and there was no fear. What we did, we got the data, we put the science together, and we planned something as to how we're going to deal with this pandemic. This is why we're in this stage here today. It took planning. We didn't panic, and we didn't frighten. Coming to speak of this, I tend to think if we're all Hindus and we believe in reincarnation, I think the PM must have been a physician in his last life. But let's move along. So then we come into the other things. So far, we've done PCRs and rapid testing, which I'll come to a little later. But let me just tell you what's been happening as regards to the public health and social measures, which we're asking the people to adhere to. We put them out there in the public please adhere to those measures. These are the measures that have brought us here today, and I must reemphasize that we need to follow these guidelines. These are the guidelines that have been formulated all over the world, and they have been working. So I want the public, and I must say that the public has been encouraging in their endeavors in terms of keeping those measures, and we want them to continue. But it was a much bigger activity than just the public health and social measures. We had to actually build hospitals. We heard China built hospitals. We built hospitals as well. We actually built in Portsmouth. The Minister for Trade was very active in that regard, and the Minister for Communication and Works. That is why we had the COVID hospital built in Portsmouth. Barely in about, 8 to 9 days, we built a hospital in Portsmouth. So, Mr. Speaker, you have to, and then we built a second one, just in case. And you have to look at this from the point that we thought, well, just in case there was a surge, we're not going to wait for the surge for us to start to do things. We built the hospital before, just in case that if there was a surge, we had a hospital. So we had a 30-bed hospital in St. James in Portsmouth, just waiting in case we had a surge. Let alone that, we were proactive in the sense that we got more medical personnel from Cuba, just in case there was a surge. We were thinking ahead, Mr. Speaker. And then our lab, with our PCR, we're doing more and more, just in case there was a surge. So we don't sit down and wait for things to happen. We're being proactive. That is what the Ministry of Health is all about, Mr. Speaker. Our quarantine facility, people cannot complain. You get one or two little hiccups here and there. But by and large, everybody is pleased. Everyone is pleased. You have an air-conditioned room, you have TV, you have fridge, you have microwave, you have stove, you have internet, you're getting meals on time. After all, Mr. Speaker, let's be reasonable. Let's be reasonable. We cannot complain about this, Mr. Speaker. Our surveillance continues in the district, of course. In the district, our surveillance, we don't just assume that we're COVID-free and we call it a day and then we sit down. We continue to test, Mr. Speaker. As a matter of fact, we just got another vehicle from PAHO, and our primary healthcare teams are going around, and we're still testing people, although we don't have any positive cases. But we're not taking a chance, because we are bringing in people. The borders have opened, so we have to keep testing. That's what surveillance is all about. And you heard it earlier, testing is a critical part of our defense against the COVID-19. Now, in terms of our borders, we've opened our borders, and this is uncharted territory. There's no blueprint as to how you open a border, but we've done it step by step. So now we're doing nationals and residents. Soon we're going to go to the non-nationals. And we're still taking all the precautionary measures as to our testing and our protocols. We have the online protocols, online questionnaire which has to get filled out, and all the different
27 more minutes.
Okay, and all the different 27, Mr. Speaker? Okay, yeah, let's go. And then relief, and then so yes, and our opening of the borders. And so far it's been going pretty good. We brought in more than 200 people through our border, through Douglas Charles, and some coming through the Longhouse. And then we've actually had the quarantine of about 130-something. So, and all of them have tested negative, and all of them are followed up in the district. Because we don't just send you home and that's the end of it. Our primary healthcare team will be following you up in the district. This is another line of defense. And obviously the testing in the district is another line of defense. But with this said, Mr. Speaker, I have to thank PAHO, I have to thank the People's Republic of China, the Bolivarian Republic of Venezuela, and I also must thank the Republic of Cuba for the assistance they've given us in fighting this pandemic, and we're very grateful for that. So, and not only that, we have to also thank our local businesses, we have to thank all the public that have been taking part in all of this, and the other stakeholders. I'm scared that I miss out one, but I'm going to try. It's customs, immigration, DASPA, DDA, the Agricultural Department. Minister Laville played a big part here. Mr. Douglas played an excellent part here. And Minister Darrow as well played a part, and Honorable Charles played a part as well. And Ambassador Barron in terms of helping us regarding our border control. Now, this is just here. But Mr. Speaker, this is the structural part of what we're talking about health. And we didn't use COVID as an excuse. That is important to note. Even while COVID was there, we adjusted accordingly with our protocols, and we continued all our different health programs. That is why our health centers continued, that is why our hospital continued, and all the different services provided at our health centers never stopped. We just adjusted accordingly, put protocols in place so that the people can benefit from the health services, and we never stopped at all. And that is how a government leads, by example. You continue to do. Because we have to live with COVID for now. COVID is not just going to go away. So we have to continue what we're doing. We just have to adjust accordingly and make the best of the different protocols that we have put in place here. But, Mr. Speaker, with all of these structures that I've mentioned, what is the heartbeat of this health system? The heartbeat of this health system is the healthcare, the providers, our doctors and our nurses, the ward aides and the cleaners and the maintenance people. That is the heartbeat of the health system. We can build all these structures, but if we don't have the people, the healthcare providers, then it wouldn't mean much. And if you can tell me that internationally we're being praised for how we handled COVID, and then people come here and talk about the healthcare system. Mr. Speaker, how does this happen? How does a broken healthcare system that doesn't function put you #1 in the Pan Americas? I'm stunned. I just cannot believe someone could make that statement. That the healthcare system that puts you #1 in the Americas? Come on, Mr. Speaker, we have to be honest about the whole situation here. But let us continue. Let's move along. It's positive vibes. Let's just move along. And I will be the first to admit, Mr. Speaker, no system is perfect. There's always room for improvement. What are we doing? What have I been mentioning here? Improvement after improvement after improvement. In this little nature aisle, you get a PCR test in 12 hours. In the US, it's in 5 days. Let's be honest, Mr. Speaker. That is what the healthcare system is all about. That is the improvement that has been going on. And we're not going to stop. But I know there's room for improvement, and we're working on those improvements, Mr. Speaker. So the future for health, I'm not panicking, Mr. Speaker. And I don't want the Dominican public to panic at all. We have your back, and we're going to put things right. We've been putting things right, and that's what we're doing here, the healthcare system. The people have to play their part. That's an integral part of it. The government will play its part, but the people have to play their part, whether it's following the public health and social measures, whether it's adjusting their lifestyles. So we'll put everything, the system will be there, it's just for the people to make use of the system. And if we can do this, the future is bright for health in Dominica, Mr. Speaker. Now, the Ministry of Health, I must say we want to thank all the different heads of the different departments. Our PS did an exceptionally good job. Our PNO, great job. CMO. We have to also thank Dr. Ferrara and Dr. Diane Robinson that did play a part in the COVID time. They brought them in specifically to help us, and they did a very good job, I must confess. All the orderlies, the ward aides, the cleaners, the maintenance people, they played an excellent part. Pharmacy, health promotion, the epidemiologist, Dr. Ahmed, hats off to Dr. Ahmed, he did a great job. Shari Shillingford, environmental health, Ms. Thomas, excellent job as well. So everybody played their part, and the lab played a great part. So these are all the different areas that played a part in our healthcare system. And we are very proud of these people. Now, Mr. Speaker, let me just talk a little bit about my constituency. Let me just say some special greetings to the entire Roseau Valley, Mr. Speaker. Pleasant, friendly, hardworking, innovative people. And the thing is interesting to note that we're a farming community, we're tourists, the epicenter of tourism, and what we're accustomed to do is to welcome people. It was sad that during COVID, we couldn't be welcoming people, and we had to just take it easy. But now that things have opened back in a gradual manner, we're back to our normal selves, we're back to our social set of people, and we welcome everybody back to our different tourist sites. And it is good news for us that we can be back on that stage. This is what we're comfortable doing. That's what we're accustomed to do, and that's what we will continue to do. But, Mr. Speaker, the budget, I listened to the Prime Minister's address, and I thought that budget was meant for the Roseau Valley. But I suspect every other parliamentarian here thinks the same way as well. Every other parliamentarian is thinking, oh yes, this is for my constituency. And when we consider the sort of hard times that COVID has brought, and we can present such a budget in these COVID times, we cannot complain. So the achievements that have gone over the past financial year and what is going to happen in this financial year, 2020-2021, for instance, we completed our Cochrane Road, 3.7 kilometers at $23.6 million. And Mr. Speaker, if you haven't driven on that road, you should just take a little drive on that road. But what the road does, it just provides the opportunities for the village of Cochrane, whether it's for the Rabbit Festival, whether it's for a bypass, that if at all the road coming through the Antrim there is blocked, that we can use that road, and the tourism potential for Midland Falls, and we started work on the road to Midland Falls, and that will continue in this financial year as well. And then as for sporting in Cochrane, we've actually put up the poles and the wiring for the football field. What we're going to do next is the lighting. So in this financial year, all that will be completed in Cochrane, Mr. Speaker. And our community road enhancement program for Cochrane, this will continue. And housing. We have the pre-Conco houses we're building in Cochrane, and we have allocated land for the apartments in Cochrane as well. So Cochrane will be benefiting from this housing revolution that we're talking about. In terms of agriculture, fertilizer to the farmers and assistance to the rabbit farmers, which is on the cards for us in Cochrane. So Cochrane is not being left out. They're getting already, and they're going to get a bigger part of the pie. Roads again in Mont Prosper. As a matter of fact, now we are constructing the road from Savan upwards, that's the L'Escalier Road, and that's $9.1 million. Mr. Speaker, when you talk about roads in the valley, because of our terrain and the rainfall, we're talking millions, double figures. And this is what the government is invested in the road network in the valley, regardless of how small the village may be, regardless of which side of the fence the village may be, but we're spending money in the road. So regardless of what I said, regarding the sides, etc., the money is being spent in the Roseau Valley, and it goes into millions. And many other side roads will be built in Mont Prosper. We're going to do the Moore Hill Road very soon. And the farmers, the Overbridge Road, we haven't forgotten you. In this financial year, we'll be investigating how we're going to rehabilitate that road as well. But in terms of sporting, we've had the playing field done in Mont Prosper, and we just have to do some other little minor things so we can get into a better playing surface. And then just this week, we had the handing over approval for the fencing and resurfacing of the basketball court at the school in Mont Prosper. So this is another thing that's going to go on for sports in Mont Prosper. We're going to fence the schoolyard, we're going to resurface the basketball court, and we're already sourcing state-of-the-art basketball backboards, see-through ones, for our court in Mont Prosper. So we'll have an excellent court in Mont Prosper. And I have also visited the sites where apartments will be built in Mont Prosper. But let alone that, we have also the water for Mont Prosper, Mr. Speaker, 30,000-gallon concrete reinforced storage tank, pumping station in Wharton Haven, and the laying of a pumping line and distribution line upgrades. That is going to cost $2.35 million. And the tendering for this is now ongoing, and the works is expected to commence in September and will be completed by February next year. Mr. Speaker, this government doesn't just see water as, you know, we used to hear clean drinking water, pipe-borne water. No, this government sees water as a right. It is a right. So this is how we handle water for the people of this country. So when we come to Wharton Haven, our Sulphur Village, we have the rehabilitation of the Wharton Haven Road. We did most of it, almost 85% of it. There's a little piece left between Casso and Savan, which will be done. But if you were to look at the road network in the valley, I think we have a pretty good network in the valley. Considering our terrain and the rainfall, Mr. Speaker, you can drive to Loda within a few minutes. You come up to Trafalgar, excellent road. You come across to Wharton Haven, that's fine road. You come down Wharton Haven and come to Copthall, all that is excellent road. And we're doing the Mont Prosper Road in a geographical area like the Roseau Valley. To have such road, hats off. Now, Mr. Speaker, coming from the tourism part in Wharton Haven, it's interesting to note that, can you imagine, during COVID, you have Sulphur Spas being opened in Wharton Haven. When everything is shut down, you have, that is the ingenuity and that is the entrepreneurship of the people of Wharton Haven, that we actually had a new Sulphur Spa open during this COVID period. Hats off to the people of Wharton Haven. And not only that, we also have the vendors arcade at Wharton Haven that will be built shortly. The Minister of Tourism explained that to you. We got $1.3 million for that. And initially, we had a bigger plan to have all different sorts of restaurants and all these things, but we were concerned that maybe if we had such a big plan, the benefits might not stay for the people of Watton-Waven. So we adjusted, and we wanted everything to stay within the village of Watton-Waven. That is why we opted for the vendors arcade with washrooms, etc. So it's a plan. Then as for Watton-Waven and the school, Mr. Speaker, our school in Watton-Waven almost complete. As a matter of fact, just some plastering going on and the priming going on. We have a pre-K building, we have the kitchen, the bathroom. So Watton-Waven is well taken care of. I've already had discussions with the Chief Sports Officer, Mr. Shillingford, as regards to upgrading our playing field there. And we have identified areas in Watton-Waven where most probably we'll be building the apartments. So even Watton will benefit from housing. So every village in the Roseau Valley, Mr. Speaker, benefits, whether it's from water, whether it's from housing, whether it's from tourism. We're making allowances for all the village in the Roseau Valley. And also Watton-Waven will also benefit for the Water Strategic Development Program, Water Sector Strategic Development Program, to commence this financial year as well. We come to Loda, Mr. Speaker, cool, calm, peaceful village of Loda, the getaway village, so to speak, where we have the Boiling Lake, the T2 Gorge, Freshwater Lake, Bury Lake, Cathedral Falls. Not many people have heard of Cathedral Falls. Loda seems to be just breeding tourist sites. We all knew about T2 Gorge, Freshwater Lake, Bury Lake, and now we have Cathedral Falls. Those who haven't been to Cathedral Falls in Loda should definitely try to get to Cathedral Falls. If you ask me, I think it's one of the better falls. Not the biggest, but really, really beautiful. So that's Cathedral Falls, just before T2 Gorge, Mr. Speaker. And then, obviously, just in Providence, just before Loda, we have our sanctuary, rainforest, eco resort, and spa. Hopefully, this should be open in 2022. What this is going to do is bring in tourism, more tourism to the village of Loda and the Roseau Valley by extension, jobs for the people, sale for the agricultural produce in that area. So, Mr. It's just a win-win situation for the people of Loda and all the different projects. The geothermal, you've heard about it, and initially the bids were higher than we anticipated. So with the redirection of the reinjection wells, that's going to make it much better, and we should pull this through. The intention here is by 2030, we should have, with hydro and geothermal, Dominic will be 100% renewable energy. And that would be a great achievement for us by 2030. And what it does with geothermal and hydro, what it does, it cuts down the cost of energy. When you cut down the cost of energy, it obviously makes it easier for manufacturing and the tourism industry. So it makes them more competitive, Mr. Speaker. And Loda, we have identified areas for the apartments in Loda as well. So Loda is going to get a pie of the housing. Coming to Trafalgar, Mr. Speaker, Trafalgar will benefit from the Water Sector Strategic Development Program. That is Trafalgar, Shawford, Focani, Copthall, and Watton-Waven. So we're going to add a new supply. This project seems to provide a new water source to the Roseau Valley by construction of a new intake in the Providence area near Loda. As such, the project shall provide increased water quality and greater consistency of service following periods of heavy rainfall due to greater soil stability and the vegetation cover of the proposed site, which is much better than where it was before. And that is going to cost about $5 million, and it will take about 9 months, and it should be complete by April of 2021. In Trafalgar, Mr. Speaker, we're happy that our health center is back and functioning, and the people of Trafalgar are very pleased about that. And also our playing field in Trafalgar, we had the drainage done properly, and the field surface, we have also improved there. And our basketball court, I'm in the process of getting the backboards for our court, which we're going to fence up and resurface as well. Our community and resource center in Trafalgar, Mr. Speaker, if you haven't seen it, you can pass by. We're moving at a pace, very, very fast pace, and we intend to finish our community center this year. This community center is going to be like an incubator for talent and just to promote the village on a whole. We'll be having all our different talks and all our different activities so that we can instill all the good stuff into the youth, and then we just blossom into a real beautiful community in Trafalgar. It has all the offices, the kitchen, the multi-purpose hall, recreation rooms, first aid, dining, state-of-the-art community center and resource center, Mr. Speaker. And this will be completed within the next 2 months. Our tourism sites, Trafalgar, you heard the Minister of Tourism said the amount of funds we've had for this tourism site, and we're going to improve the product there. Housing for Trafalgar, yes, in Lily Valley we have housing. We have about 15 different units being built. Some are the 2-bedroom,
10 more minutes.
some are the 2-bedroom, and some are the 3-bedroom ones. And they're almost 85% complete, and this will be handed over as soon as they complete, most probably at the end of this year. And that is housing. And in Mataz, that's just before you enter Trafalgar, that's after Shawford, we have another housing going to start here with MMC, and that's just going to be a bigger project of maybe, I think, more than 35 units going to be built there. And this is housing for Trafalgar. So as I said, every single village benefits from this in this fiscal year 2020-2021. And all the different restaurants in Trafalgar, I must mention Ivo's Bar, Merle, Stafford Morancy, Omo, Sandrine, Heki, River Rock Cafe, Natty Pool Bar. These are all the different entrepreneurs in the Rosa Valley that have stuff going on. The smaller areas in the Rosa Valley, like Coptal, they haven't been left out. As a matter of fact, we did the Coptal Road prior to the elections, and everybody thought it could have been a gimmick. We're continuing the Coptal Road now. It wasn't a gimmick. It wasn't a gimmick, Mr. Speaker. The Coptal Road has been continued with excellent drainage as well. And the water supply, which I spoke about earlier, will also benefit Coptal. As for Shawford, they're going to benefit from the water supply, and we have a couple roads that we're going to do as well. And Fokani, water supply is going to benefit the little hamlet of Fokani as well. Cabanis, that's just before you reach Fokani. There's been some road failure, and the government has allocated $5 million for repair of that road in Cabanis. That is significant and that is important. That's the main road going up where there's Loda, Trafalgar, entering the valley there. So that is going to be done. And Minister of Communication and Works has assured me that yes, this will be done in this financial year. But the Rosa Valley, apart from all of this going on, which is really a mouthful, but in terms of education, we have more than 25 people studying all over the world at different universities. So we haven't been left out. And this is part of, we just stick into the whole dream of a university graduate in every home. And we're part of this as well. So education, we have been left behind, and we've been part of that. But I must thank and I must extend my gratitude to all our NEP workers in the Rosa Valley that have kept our roads clean and our beautification, and they have also helped us in our disaster preparedness part. So our NEP workers, hats off to them. We have some great teams functioning there, and the young men and women are doing an excellent job at it. But Mr. Speaker, just closing up, I must confess that this budget has something for everyone. It's a win-win situation, both for the government, both for the people of Dominica. I think everybody should be proud of such a budget. It caters for everyone. We have the Emergency Agricultural Livelihood and Climate Resilient Project, which the Minister of Agriculture will talk about, and touching all the lives of the farmers. And we have about $1 million for livestock farmers already in this one. We have 13 million in the whole budget here. We have 13 million for marketing of our 10 most visited sites. We have 23.2 million to cushion the negative impact of COVID on the micro, small, and medium-sized enterprises, because the highly concessionary loan facilities we have, livelihood grants to these businesses and employees. As a matter of fact, 799 people, Mr. Speaker, have received from these grants. And there are 292 approved, and we have 390 loans. And all that is part of these to combat the negative effect of COVID. At the Aid Bank, we heard the 30 million, 4 million this year at 1%. And we also see the benefits to the registered tour operators, the 1% loan facility, duty-free concessions on supplies and goods, the import duty and excise duty exemption on motor vehicles, all of this just to stimulate the economy, Mr. Speaker. And the concessions for manufacturers as regards to packaging and labeling material so that they can be more competitive. And that is all in effect of having the economy boosted, Mr. Speaker. Students, they're not left behind. 40% of their loans have been waived. It means a lot. When you come back from university and the first thing you're looking at is a student loan. You haven't even buy a house, you can't pay rent yet, you don't have a car yet. And when the government says we're going to take out 40%, excellent. That just helps out. And Mr. Speaker, with all the construction going on with the housing, what it means, it's employment. So when people talk about employment, this is where employment comes as well. With all the housing construction going on. And all then we have also the reduction in land transfer fees. So many people have land. You want to take a loan in the bank, you don't have a title, because you can't transfer it. These are the little things that they all add up to make Dominica the better place that it has been. In terms of the grant for the first-time owners, I've met so many people that they are so happy. First-time home owners, they can now get those grants. And then, Mr. Speaker, tax amnesty. You pay the principal taxes owed prior to 2019, between August and November, and then we waive the interest and the penalties. So the government gets more money, but you also pay less. It's a win-win situation, Mr. Speaker. All through this budget, it's just a win-win situation. So, and then in terms of other things that the Ministry of Health, I just want to come back quickly. They mentioned earlier about the marijuana industry. Mr. Speaker, we're thinking of those things long back. In January, I had a discussion with Dr. Emmanuel. Dr. Emmanuel was in Jamaica. He's one of the authorities on the cannabis industry. Minister Grant, Minister of Agriculture, was there. So it's not something that people come and talk about here. We've been thinking about it long before COVID. And it's not just a matter of recreational marijuana. It's all about the medicinal aspect. And we're in a better position because a lot of the other Caribbean islands have gone and they have blundered here and there, so we are learning from their mistakes. And just about 2 or 3 weeks ago, I had a discussion with Dr. Casimir as well. So this is something that's in the cards. We're thinking of the bigger picture for cannabis, whether it's medicinal. I mean, we know about the recreational part, the spiritual part, but the other medicinal part, so that we can get into cooperatives. That's how we have to do the marijuana thing, cooperatives. And obviously, the traditional stakeholders won't be left behind. Nope, we know the Rastafarian community. We're not going to leave them behind. But it's a bigger picture, and we don't just want people just planting ganja all over the place. That's not what we're about. We have this thing locked down in a very scientific way, how we're going to go with this cannabis industry. So we've had discussions about it, and yes, we're going to go that way, and we've planned properly for all those things. So, Mr. Speaker, having said all of this, I told you how the healthcare system has evolved. I told you how the new healthcare system we have for this country. I've told you the different achievements we've had in our healthcare system. It's because of all these different interventions at the primary healthcare level that we can talk about all these different achievements that we're having. So with this said, I want to tell the Dominican public we have their back. The healthcare system has been working. As a matter of fact, Mr. Speaker, can you imagine Lunera? It's a German-based statistic company that brings out the different statistics. And they've rated Dominica the first in the entire Pan Americas. The other organizations have rated Dominica within the top 15 in the world. So when I hear people come and talk about our healthcare system, I don't know how do you achieve those things with a broken healthcare system. And it is not fair to say that because the healthcare providers have been working so hard for us to reach this stage, and we come here and just criticize like this. No, Mr. Speaker, I don't know how people get into this criticism mode. We have to rise above those things. You can't just come and criticize and criticize. That is just a negative approach to life, Mr. Speaker. We have to see the good in everything. We have to be optimistic. We have to be positive. The healthcare workers are breaking their back to give us this achievement where we are COVID-free now, and then people want to just jump on their back. This is not fair, Mr. Speaker. So with this, I think I could go on and on, Mr. Speaker. I'm going to leave a little bit behind. I wish I could have given it to you, but I think you get the general picture that health is, we're in a good stage, Mr. Speaker. We're in a good stage. And I thank you very much, and I have actually no objections and no reservations in approving this budget. Thank you, Mr. Speaker.